अस्सलामुअलैकुम। आज हम नर्सिंग प्रोसेस के बारे में पढ़ेंगे। नर्सिंग प्रोसेस एक बहुत ही इम्पॉर्टेंट टॉपिक है नर्सिंग फाउंडेशन में, और ये खाली आपको नर्सिंग फाउंडेशन में नहीं चाहिए, थ्रू आउट योर 4 ईयर्स और थ्रू आउट योर 8 सेमेस्टर्स नर्सिंग प्रोसेस बार बार रिपीटेडली यूज़ हो जाएगा, और ये एग्ज़ाम पॉइंट ऑफ व्यू से भी बहुत ज़्यादा इम्पॉर्टेंट है। आज हम इसी के बारे में पढ़ेंगे, नर्सिंग प्रोसेस क्या होता है, कैसे बनाते हैं हम, हाउ टू अप्लाई ऑन द पेशेंट। सो लेट अस स्टार्ट। So, nursing process is a systematic, rational method of planning and providing individualized nursing care. यानी ये जो नर्सिंग प्रोसेस होता है ये एक सिस्टमेटिक वे है जिसमें हम प्लान करते हैं कि पेशेंट को किस हिसाब से केयर प्रोवाइड करेंगे। और जब ये हम प्रोवाइड करते हैं केयर, जब हम प्लान करते हैं, हम इंडिविजुअल नीड्स देख के ही प्लान करते हैं। मींस अगर आपके पास दो पेशेंट हैं विद द सेम डिजीज बट दोनों का केयर प्लान एक जैसा नहीं हो सकता, देयर मे बी सम काइंड ऑफ वेरिएशन, दैट इज व्हाट वी कॉल्ड एज इंडिविजुअलाइज्ड नर्सिंग केयर। सो द नर्सिंग प्रोसेस इज एक्चुअली प्रॉब्लम सॉल्विंग अप्रोच। तो यहाँ हम क्या करते हैं, पेशेंट की प्रॉब्लम को आइडेंटिफाई करते हैं और उसको सॉल्व करने के लिए इंटरवेंशंस बनाते हैं। बट जो भी हम इंटरवेंशंस बनाते हैं वो बेस होते हैं ऑन साइंटिफिक प्रिंसिपल्स, and by this method we are able to meet the patient's needs. So and nursing process is cyclic because जब हम कोई चीज़ पहले assess करेंगे, फिर diagnose करेंगे, उसके बाद हम intervention provide करेंगे, and after that we check the feedback कि जो हमारा intervention है इससे patient को benefit मिला है या नहीं मिला है। In case अगर benefit patient को नहीं मिला है, we repeat, we take the feedback and we repeat the process, we alter our interventions. So that is why we call it as a cyclic process. So and it follows a logical sequence, step by step हर कोई process करना है. Before providing care we cannot evaluate, we can only evaluate after we have provided the care. That is where we have to follow a logical sequence. So let us see the definition of nursing process. Nursing process can be defined as an orderly, systematic way of identifying the client's or patient's problem, making plans to solve them, then initiating the plans or assigning others to implement it, and then finally evaluating the extent to which the plans was effective in resolving the identified problems. So nursing process is an orderly, systematic way, एक ऑर्डरली एंड सिस्टमेटिक वे होती है जिसमें हम आइडेंटिफाई करते हैं ईदर क्लाइंट की और पेशेंट की प्रॉब्लम, एंड उसके बाद आइडेंटिफाई करने के बाद वी मेक द प्लान टू सॉल्व द प्रॉब्लम्स, and then after making the plan then we initiate the plan or we implement the plan on the patient or client, or we can assign somebody else to implement it, and then we evaluate our plans, those we have implemented or the patient, whether those were effective in solving the problems or not, and if they are not effective enough to solve the problem we again modify our plans. What is the history of nursing process, or let us see where from it actually came into existence. सबसे पहले नर्सिंग प्रोसेस टर्म जो है वो इंट्रोड्यूस की है लेडिया हॉल ने इन 1955, and as per her she identified three aspects of nursing care, that was care, cure and core. Then in 1959 Dorothy Johnson, she described three steps of nursing process, and those three steps were assessment, assessing the patient's condition, collecting the data, decision making, what should we do to solve the problem after taking the data, and then nursing actions, actually doing the intervention on the patients. Then after that in 1961 Orlando explained a three-step nursing process about the client behavior, nurses reaction and nurses actions. Client behavior means the patient's problems, we can say. For example, if a patient is having pain, so what kind of behavior the patient will be having? Either the patient will show the facial expressions or the patient will verbally say that I have the pain. What is the nursing reaction to that behavior? And then finally, what she does to solve the problem, that is the nurse's action. In 1963, then Louise Novel she gave a five-step nursing process using the 5 Ds, which was discover, delve, decide, do, and discriminate. Discover and delve steps are related to the assessment phase, decide is the planning phase, do is the implementation stage, and then discriminate is the evaluation phase of client responses to nursing interventions. Now we should discuss about the purpose of nursing process. So the main purpose of the nursing process is to help the patient in maintaining health. So by preparing nursing process, our main aim is to help patients in maintaining their health. And once patients are able to maintain their health, it protects them from illnesses. It helps us to identify client's health status after assessing the patient's condition, to identify client's actual and potential health problem. Actual problem is for which the patient has been admitted or which is present at the time of admission, and which is the reason for admission for the patient. And if that problem is not managed properly, it can lead to the some future problems which is called as potential health problem. For example, patient has undergone surgery and the surgical site is our main aim, and we have to take care by doing the bone dressing. That is the actual problem of the patient. But if you are not able to maintain proper aseptic techniques while dressing the patient, so it can lead to infection of the surgical site, can lead to the gangrene. That will be the potential health problem. It helps us to determine the priorities regarding the patient problems and to manage them accordingly, to initiate or establish plan for meeting the identified needs, to deliver the specific nursing intervention. After identifying the patient problem, making the priorities, and then finally making a plan for meeting the needs, we can deliver the specific nursing intervention. So finally, once we have delivered care to the patient, it nursing process provides us with a provision for evaluation of our care provided. So we can check whether our care provided was effective or not, and if the patient's condition does not improve, we have to again replan the intervention. It helps us to promote recovery from illnesses. It helps us to promote return to a state of maximum functioning. So these were the purposes of nursing process. Let us now discuss about the various steps which we should follow during the nursing process. So the basically, as we have already gone through the history, previously there were only 3 steps, but the current trend is we have to follow the 5 steps of nursing process. And these include assessment, diagnosis, planning, implementation, and evaluation. The first step of the nursing process is assessment. So assessment is basically collecting the information from the patient, verifying that, and then organizing that data which we receive about the client's health status. It involves collecting data from variety of sources. For example, if you are asking the history from the patient, that will be the primary source. If we are asking the history from the attendant, that will be the secondary source. And we use both primary, secondary sources, and we check the previous documents as well, which again is a secondary source. By collecting the information from various sources, we actually verify this data after collecting. And after verifying by objective assessment, वंस हमने डाटा कलेक्ट किया है पेशेंट से पूछ के फाइल चेक करके पेशेंट की अटेंडेंस से पूछ के उसके बाद जो हमने कलेक्ट डाटा किया उसको हम वेरीफाई करते हैं वेरीफाई कैसे करते हैं फॉर एग्जांपल इफ ए पेशेंट सेज आई एम हैविंग फीवर हम फिर थर्मामीटर यूज़ करके टेम्परेचर चेक करेंगे टू चेक वेदर पेशेंट really has the fever or not, and then accordingly we organize the data and set the priorities कि पहले किस वाली प्रॉब्लम को हमें priority देनी है, उसके बाद कौन सी वाली नर्सिंग डायग्नोसिस को priority देनी है, उसके हिसाब से ही हम intervention provide करेंगे. So it is also assessment can also be used during the diagnosis phase to validate a diagnosis. For example, if we are saying that the patient is having hyperpyrexia, then finally again we are checking the patient's temperature to make it clear whether the patient really has a hyperpyrexia and how much is the temperature range. What are the purposes of now nursing assessment, which is the first step in the nursing process? There are various purposes. It helps us to gather information regarding client's health status. It helps us to organize the collected information, to enhance investigation of nursing problems, and helps to frame the nursing diagnosis, to identify health problems, to identify client strengths, and also to identify need for health teaching. For example, if you are asking something from the patient and he is not sure about the various, he is having a confusion regarding various medical terms and various conditions or diagnosis, then you can identify that there is a need for health teaching to the particular patient. So these were the various purposes of nursing assessment. After assessment, the second step in the nursing process is nursing diagnosis. Let us see its introduction. So first of all, you should remember that nursing diagnosis are not medical diagnosis. They are not medical treatments prescribed by the medical physicians. So nursing diagnosis is a different thing and medical diagnosis is totally a different thing. The nursing diagnosis can be the actual or potential health problem that are amenable to resolution by nursing actions. Means जो नर्सिंग डायग्नोसिस होती है या तो वो पेशेंट की एक्चुअल प्रॉब्लम हो सकती है होती है उस टाइम जो प्रेजेंट है. For example, if a child is having fever, so hyperpyrexia will be the actual nursing diagnosis, and if it is not properly treated, it can lead to the febrile convulsions, which results in the potential health problems. So these problems are amenable by resolution. If nurses take the action or provide the intervention, you can overcome those problems. And when developing the nursing diagnosis for a patient, the nurse must identify the commonalities among the assessment data collected. For example, let us take again the example of a fever. Patient is saying, I am having fever. And you are just touching the patient's forehead and you are feeling it's hotter. You are touching the hands and those are hotter. Then again, you are actually collecting or verifying whether the patient really has the fever by checking with the thermometer. So all the three kinds of data which you take from the patient, which you assessed and finally which you checked, they are common. That means they are saying that the patient is having the fever. So always once and after that you are making a diagnosis of regarding hyperpyrexia. So actually this is what we say that the nurse must identify the commonalities among the assessment data collected before framing a diagnosis. Now let us see the definition of the nursing diagnosis. So, nursing diagnosis is defined as a clinical judgment about either an individual or a family or community experiences or responses to actual or potential health problems. So, it is a clinical judgment, a judgment a nurse makes about a patient after assessing his or her condition. Then, a nursing diagnosis provides the basis for selection of nursing intervention. Once we are framing the diagnosis, then accordingly, as per the diagnosis, we are selecting the appropriate intervention to achieve the outcome for which the nurse has accountability. For example, for example, if a patient is again having a fever, we are checking the temperature and our intervention is cold sponging. And after cold sponging, there must be a decrease in the patient's febrile condition or fever should be decreased. So that's why we selected the appropriate intervention, that is cold sponging, after framing the diagnosis that the patient is having fever. Third step in nursing process is planning. It comes after the diagnosis. So the next step in the nursing process is planning activities to promote healthy client responses. Or the planning helps us to prevent or correct or reduce unhealthy client responses. And planning is defined as development of nursing strategies or intervention which are designed in such a way so as to alleviate the client's problems. And this was given by Craven. So planning means selecting the appropriate remedy for the nursing diagnosis. For example, a patient is having urinary retention. Our intention will be our next step would be if a patient is having the prolonged urinary retention. So the intervention or planning for such a kind of nursing diagnosis will be putting an indwelling catheter. But we are just planning to put. We have not yet actually inserted the catheter. We have just planned to put the catheter. Now let us see what are the various purposes of planning. Planning always gives direction to the client care activities. So planning is a blueprint that what you are going to do with the patient so as to solve his or her problems which you have framed in the nursing diagnosis. It enhances continuity of the care. Planning helps us to see in advance those things that can help us achieve our goals. For example, you have a patient with dyspnea. You have framed and diagnosed after assessing the data, after checking his saturation level, you have seen that the patient is having breathlessness or dyspnea, difficulty in breathing. So accordingly, to overcome that problem, you are just going through planning. That means you are planning the various interventions. So, for example, your intervention will be to give a proper position to the patient, give oxygenation. So these may be the some of the interventional plans which you are preparing, and they will help you to understand. And once you are planning, then accordingly after that you will implement that. And these plans will help a nurse to achieve her goals. And also those things can prevent us from achieving our goals, and also it helps us to understand those things which helps us in from preventing or which prevent us from achieving our goals and outcome. Then planning helps us to be accountable for what we do, because whatever intervention you are giving to the patient, you are held accountable or responsible for those interventions. So once you have a proper plan, you can do it appropriately. Then plans help us decide how best to use our resources. Planning lays the basis for us to assess and evaluate our achievements effectively. For example, you have prepared the plan for dyspnea, and once you are evaluating your patient, if your patient's condition does not improve, you will try another one. So you can evaluate yourself that these interventions are not going to help the patient, so we have to check out the other alternatives. And it also helps in to permit us in delegation of specific activities. For example, we have planned that patient is having fever and we have to go for cold sponging. So it's not necessary, if you are very busy in the ward, it's not necessary that you yourself will do the colds. You can assign an attendant for him and he will be doing the cold sponging. But you have planned that the patient should receive cold sponging, but you can delegate the responsibility to the attendant. Then one more thing is nursing intervention, which is the fourth step. You can say the nursing intervention or you can say the nursing implementation. It is actually the implementation of the plans which you have prepared in the previous step. So here you are actually doing. In planning phase, you are just planning what we should do, and here you are actually performing those actions. So nursing intervention is nursing action, and the action may be treatment, any diagnostic or therapeutic procedure, or any nursing activities. For example, giving medications, taking the patient for some diagnostic tests, taking sampling, or for example, doing some therapeutic procedure like back massaging, position changing, or any other nursing activity. So nurse is performing an action to achieve outcome for a medical or nursing diagnosis to which nurse is accountable. Nurse is performing action for only those problems for which she is accountable. For example, she is accountable for the patient care, which include all the basic needs of the patient, which include the minor ailments of the patient, which include providing care, giving medication. So she is doing action as per those. She is giving the intervention as per only those things which for which she is accountable. And if, for example, a patient has to go for the surgery, so if the surgery is delayed, nurse will not be held for such kind of problems. If the surgery is delayed because nurse has not properly prepared the patient for surgery, then that will she will be accountable for those conditions, for not accountable for performing the surgery. So nursing intervention is actual implementation of the care plan. So whatever care you have planned, here it is the actual implementation of that care plan. Nursing interventions are designed to promote, maintain, or restore the client's health. So these interventions are designed in such a way so that they help to promote the health, maintain the health of the patient, or restore the client's health. Now let us see the definition of nursing intervention. So nursing intervention is any action taken by the nurse to help the client move from present health state to the health state which is described in expected outcome. इसका मतलब ये है कि ये वो वाली एक्शंस हैं. फॉर एग्जांपल लेट मी गिव अगेन द एग्जांपल ऑफ ए पेशेंट विद dyspnea. So patient is having the dyspnea and the diagnosis is hypoxia, diagnosis is difficulty in breathing or dyspnea. Then nurse plans the activities as per proper up position, oxygenation, checking the saturation. Then in intervention phase, she actually provides the patient with the proper position or gives oxygenation to the patient after checking the saturation. Does the suctioning in case of there is secretions. So these are the intervention which she actually does. And by doing that, the patient's dyspnea will be relieved. And dyspnea was the present health state of the patient. And once the dyspnea is relieved, so nursing outcome was to relieve the dyspnea. So once dyspnea is relieved and patient is able to breathe properly, so that will be the health state described in expected outcome. So what is the purpose of nursing implementation or intervention? To provide technical nursing care, to provide therapeutic nursing care, to help the client to achieve optimal level of health. So implementation means actually providing the care. It can be the technical, which can be the therapeutic. So it helps the client to achieve optimal level of health. So if you are leaving the patient's dyspnea, patient is able to maintain his optimal level of health. If you are doing a therapeutic procedure, providing a therapeutic diet, that means you are providing therapeutic nursing care. If you are changing the cannula, if there is blockage in the cannula, you are changing the cannula, that will be the technical nursing care you are providing. And implementation helps. The main purpose of implementation is these three. Then the last step or the fifth step in the nursing process is evaluation. So the evaluation is the last step in the nursing process. Evaluation means examines the degree of goal attainment. Evaluation means to actually check whether you have achieved your goal of the expected patient outcome. For example, you have provided the proper position to a patient with dyspnea. Has the dyspnea been relieved or not? अगर पेशेंट का डिस्निया कम हो गया है, डिफ़िकल्टी इन ब्रीदिंग कम हो गई है, मीन्स आपका गोल अटेन हो गया है इन इवेल्युएशन फेज. अगर नहीं हो गया है, दैट मीन्स यू आर नॉट अटेनिंग द प्रॉपर गोल and you have to replan all the interventions. So during this phase, the nurse actually asks herself that did the client achieve the goal he or she was supposed to? And if yes, then the plan was effective. And if not, then she again asks why not? Where there was a problem. Where there was a problem, and accordingly she replans her interventions. and then a plan is revised, and again after revising the plan, again evaluation is done. So that's why there is a cyclic process. Let us see the definition of evaluation. So evaluation is defined as the judgment of the effectiveness of nursing care to meet clients' needs. That means you are here making the judgment regarding the care which you have actually provided, whether you have attained the goal or not. Let us see now their let us see now their summary and conclusion. So we discussed about the nursing process, the its steps. So it has a five main steps, which is assessment, diagnosis, planning, implementation or intervention, and then finally the evaluation. So the nursing process is the process by which nurses deliver care to individuals, families, and communities. Nursing process is a cyclic and ongoing process that can end at any stage if the problem is solved. For example, you have provided intervention to the patient and patient's fever has subsided. That means you are ending that nursing process, and again you are preparing it again for some another nursing diagnosis. So nursing process exists for every problem that an individual, family or community can have. So there is a nursing care plan for or nursing process for any kind of the patient problems, and accordingly we have to prepare it and provide care to the patient. So this was all about nursing process. In upcoming videos we will be discussing about each step in detail. We will discuss about the assessment in detail, nursing diagnosis in detail. So we will be discussing each five steps one by one in detail. Here I have just given you the idea, and thank you. If you want to give any feedback, you can give in the comment section, and if you like the video, do share and subscribe. Thank you.